Hello everybody, my name is Dr. Sharan Krishnaswamy and I'm a neuroanesthetist. Most of you might have come across what hypertension is all about. Of course, it's no surprise, but coming from an anesthesiologist's perspective, why hypertension is important to us? Because it tends to affect a lot more organs than just the heart and the blood vessels. So there is this concept known as hypertensive emergency, in which the high pressure of blood inside the blood vessel can cause damage to the kidneys, the heart and the brain. So in case a person starts to have chest pain due to high pressure, it's called angina. A patient may have a stroke because of high blood pressure, because the blood can bleed in through the brain, and increased pressure of the blood in the blood vessels leading to the kidneys can affect the kidneys. So hypertension actually has a number of contributing factors. It can be because the kidneys are not functioning properly. It can be due to stress of the individual and the person not being able to manage stressors, and it can also be due to the blood vessels becoming, thickened or hardened because of the continuous blood pressure, which causes changes in the blood vessels. So there are different ways of managing blood pressure in the form of different tablets. I mean, you have Amlong, that is amlodipine, you have telmisartan, losartan, and you also have trinitroglycerine tablets. So all of these act on the smooth muscle vessels of the heart, of the blood vessels. So this will decrease the load on the heart and allow the blood to pass freely through the blood vessels. But a person with long-standing hypertension can cause changes to the heart. I mean, the walls of the heart can become a little enlarged, and that can sometimes affect the way the pacemaker affects in the heart. The heart beats at a particular rate, known as a pacemaker rate, which is at a very constant, regular beating rhythm. But sometimes, due to the effect of the changes on the heart due to high blood pressure, what you can see is the heart may sometimes beat abnormally. So it's important to actually take your medication, take them on time, keep checking your blood pressure frequently, and also review with your physician or the cardiologist. Now, why this is important to us is because the easier or the better the blood pressure is controlled before you come for surgery, it is easier for us to give you the right kind of anesthesia and to make sure that you are stable during the course of the surgery. So what we are worried about during surgery and after surgery is that the blood pressure needs to be controlled during it and after it to prevent complications. Because if the blood pressure is not controlled, it can affect the surgery and complications may happen during or after the surgery, which will need us to be excessively careful and to treat you better with the right sort of medication. So when it comes to blood pressure control, it's important that you get assessed and treated accordingly.